I'm glad I can see lots of my students here. Okay, so let's start with a brief introduction of mine. I am Dr. Sumaiya Siddique Malik. I have graduated from Rawalpindi Medical College. Then I get a chance to complete my MPhil from ISRA University, basically ISRA Institute of Rehabilitation Sciences. And later on, I completed my MS in Cardiopulmonary Physical Therapy from RIFA Institute of Rehabilitation Sciences. Throughout this journey, I have been attached with various give me a second, please. Sorry. So throughout this journey, I have been attached with various academic and clinical institutes. And I can say that since 2014, if I will be precise, I would say that since February 2014, I have joined, officially, I have become the part of this profession. And since then, I am just practicing it and learning new and new dimensions in this profession. My last 4 years, I was being affiliated with Foundation University Islamabad campus and have been teaching there as lecturer. And I must say it was a great platform. I learned a lot of things. Talking about my research experience, I would like to share that I have supervised more than 50 DPT students and few post-grad MS students of physical therapy. I have not only helped them in writing their thesis, but completing their dissertation, and then helping them in writing the manuscript, selecting the perfect journal, or you can say the suitable journal. Coming towards my own contributions towards research, I would like to mention that I have around 8 publications in different impact factor national and international journals. I have won several cash prizes for it as well. And I have won recently, I have completed my fully funded internal research grant project that was offered to me by Foundation University. I basically competed for it and I just won it. And then by the grace of Allah, I was able to complete it in the due time. 4 of my articles are interpress. One of the manuscript is submitted in Lancet. Maybe few of you people are familiar with it. It is the highest impact factor journal. So, and this is all about myself. Now coming towards the webinar today. The idea of choosing the topic behind cardiac rehab was that it is in the past few years, it was new. Most of the people were unaware about this segment of rehabilitation. But now it has just it is slowly developing and it is slowly blooming. And I'm very glad that I'm also part of this cardiac rehab team. I have always been. And if I will ever get a chance to again join any setup, I will prefer it to be on the basis of my MS, that is in cardiac rehab. So cardiac rehab is basically an extensive term, and I can see as if most of the people who have joined today are students. So I would like to start it with the basic, that what does rehab means? I would say that there are 2 terms in this domain, rehab and recovery. And these terms are used interchangeably though, but they do not mean the same thing. By this, I mean to say that the drugs that are used in rehab programs, they can help someone with a disorder and they can drag that person onto the road of recovery. But if you talk about recovery, then recovery is itself a process that is not actually receiving any active treatment. So I hope I'm able to just, clear the difference between rehab and recovery. So what is rehab? It is basically a stepwise procedure. First of all, you have to identify the injury or the disability in a person. It can be any individual. You can talk about any individual anatomical structure, or it can be about any physiological issue. Then it can be relatable with the individual or with its environment. Then the second step is you set the objectives. First of all, you identify the disability, then you set the objectives, and then you plan and implement the measures, the necessary measures to help that individual to bring back to normal. So we can say, in a nutshell, that the interventions that are basically used, or that are basically, I think, design would be more appropriate word. So the set of interventions that are designed to help the individual in optimizing their functioning, at the same time helping that individual in reducing their disability with health condition, as well as its interaction with the environment, is called as the rehabilitation. So today we are going to talk about the cardiac rehab. It's basically, I think, I hope the CEO will just agree with this point of mine, that it should be a webinar series if you talk about cardiac rehab, because it's such an extensive topic. It cannot be completed in just a single session of some 40 to 60 minutes. So for today, I'm just going to give you people an overview of cardiac rehab, because you will get to know that in this today's session, you will get to know about the goals of cardiac rehab, what are the benefits of the program, who are the suitable individuals that can be treated through this cardiac rehab. So we can say, in other terms, we can say you will learn about the indications of cardiac rehab program, the contraindications of cardiac rehab program, and I will try my best to cover the other segments of today's lecture, that would be including how you assess the patients. And thank you, Dr. Naseeb, for agreeing me on this. So yes, we will inshallah conduct other series as well. Coming back towards, then we will talk about the phases of cardiac rehab, how we can implement, and what will be the assessment of outcomes. Yeah, what are the outcomes, or how we can just assess the outcomes. Okay, when we talk about outcomes, here is a point that I always want to mention, that if you talk about outcomes, then it's not, being a physical therapist is not always about you treat a patient and the patient gets cured. It's always about measuring your outcomes. See, most of you might be going to visiting the wards and taking the history and following the supervised clinical practice. And if you are doing so, you will be knowing that thing, that our focus is always, we always make you people learn how to write the goals of the condition, how to write the goal of the treatment plan. So I've always emphasized on this thing, that it's not always about achieving the outcomes, but it is always about assessing the outcomes that you have achieved. That means, have you achieved all the outcomes, or have you achieved few of it, or you are unable to achieve any of it? So this will be a layout, and I will try to cover it as much as of possible. So we have discussed up till now, we have just given a touch to the difference between the recovery and rehab program. Then we talk about what is rehabilitation, so that everybody will be familiar that what will be our talk of the day. Now coming toward the cardiac rehab. The main cardiac rehab is basically a focused, you can say, as we said, that rehab is not a single term, it's an umbrella term. It's encompassing a lot of different components in it. So likewise, cardiac rehab is not just a single term, it's an umbrella term. It covers different interventions. It covers the physical, psychological, and social functioning of patients. Basically, we are talking about the cardiac patients, so that they will be able to own their efforts, they will be able to resume their efforts, and they will be able to maintain as normal a place as possible in their community. So we can say that it's basically not a one person role. It's an activity that needs coordination. You have